partnership, and thank you for being here this early morning to help us kick off our 3-year National Public Health Campaign. Our campaign is really helping to spread the word about our mission to help Americans, and especially the underserved, understand how they can incorporate more seafood nutrition into their diets. And I'm really pleased to see lots of old friends and new friends here amongst us, and I just want to recognize you for being here and being with us all along the way. And so with us today we have our board members, scientific advisory council members, partners, and I just also have our donors here in our presence. So I'll go through a few of the names later, but I do want to thank you all for being here and hope you have a chance to stay with us. For those of you that are just getting to know Seafood Nutrition Partnership, and especially out in the country learning about us and hearing about us this morning across media, our nonprofit mission is to help to create a healthier America. And we have a health crisis here in the US with 7 out of 10 deaths from preventable diseases. And that means preventable diseases from diet and lifestyle changes. And seafood is a big part of it. If you just eat seafood twice a week, you can help reduce your risk of heart disease by 36%. Unfortunately, only 1 in 10 Americans follow this dietary guideline. And we have to help 80 to 90% of Americans understand how to eat healthier. How do we do that? It is with all of you today that we start this journey together. It takes a village to get this message out. And so thank you as we embark on this journey together and we mark this moment that will really make a difference in the health of all Americans. So thank you. I do want to share with you that as we get started, we did conduct pilot campaigns last year in both Memphis, Indianapolis, and also Boston. And that came about through working in both cities in Boston and Indianapolis through a grassroots advocacy campaign by building relationships with both federal and state officials, government officials in the local communities, hospitals, retail, restaurants, the scientific and medical community, to all come together to build awareness about how to eat healthier. And we were able to get the message through by helping to empower Americans, women, men, children to eat more seafood. And so now we're expanding to 9 cities, mainly focused in the South and Midwest. Why? Well, heart disease is the #1 killer of Americans, and it takes more lives of women than men. And so we are going straight to the heart of the issue, where heart disease has the highest prevalence. And so we're pleased to be able to go now to Birmingham, to Lexington, Kentucky, Oklahoma City, Charleston, West Virginia, Toledo, Ohio, Jacksonville, Florida, Memphis, Tennessee, and Indianapolis, of course, Indiana. We're going to continue with Memphis and Indianapolis for the next 3 years together. And so I'm pleased to have several of our representatives from each of the different cities that we're going to with us today. I want to highlight just a few speakers today to share with you what we are doing to make impact in each of these cities. One of our marquee programs is called Eating Heart Healthy, and that is a nutrition intervention program that helps underserved women understand how to incorporate more seafood into their diets. And it's just 4 weeks, 90 minutes a week, and really is meant to help women identify their heart disease risks and also learn affordable seafood recipes that cost around $10 to feed a family of 4. And what we found after our pilot was that 92% of the participants were able to increase their omega-3 fatty acids in just 4 months. Now, they didn't all get to the ideal level of 8% in their blood systems, but they were able to increase their omega-3s. And that's significant because when you have an 8% omega-3 versus a 2 to 3% omega-3 level, you have a risk reduction of sudden cardiac death of 80 to 90%. So every percentage increase matters. And making a difference in other people's lives is what we're all about. And so we developed this Eating Heart Healthy program with our great partners at Brigham and Women's Hospital. And without their scientific research and backing, we would never be able to create this program and find partners at Roxbury Tenants of Harvard to make this happen. So we're fortunate today to have Dr. Erin Waxman, Director of Brigham and Women's Pulmonary Vascular Disease Program, with us today to share a little bit about how we will continue our journey together as partners.
Thank you, Linda. It's a real pleasure for me to actually be involved in this kind of a program with the Seafood Nutrition Partnership. I think, as a physician, especially at a place like the Brigham, where so much is high-tech, prescribing drugs and doing things that cost tons of money, this kind of an approach, in a sense, common sense medicine, common sense just living, I think is really the way we ought to be going. You're going to hear from Jacquie soon, Jacquie Boston, who is one of the graduates of the program in Boston. And I think what's really been special about this is the kind of intervention. It's easy, it doesn't take a lot, but it has a huge impact. And I think what's also grown out of this program is that we've been able to now recruit almost 2 to 3 times as many people to get involved in this and move forward, because they see the benefit and they see how easy it is. We're now moving to include kind of a whole health approach that includes exercise along with good nutrition, and I think we're going to see simple interventions that make big differences. So I don't have much more to say other than thank you for even thinking of me as being a participant in this. It's been a real privilege, and I look forward to really a heart-healthy movement moving forward. So thank you.
Thank you, Dr. Waxman. We are pleased to have a chef, a well-known chef, be one of our national ambassadors. And with us today is a chef that is a prolific cookbook author, restaurant owner, and star of the popular Food Network show Down Home with the Neelys. Ms. Gina Neely has made some significant changes in her own life and began to eat healthier with more seafood and lost over 25 pounds. Now, Gina and I are friends from Memphis, and so I don't recognize her. So in just 5 years, she has made this heart-healthy transformation. And so we're thrilled that she is going to be joining us and traveling to each of our cities this month and really taking the message on the road and speaking to women so that they can really hear it and be inspired to change for themselves and their families. So, Ms. Gina, I'd love for you to come on up.
Thank you, Linda. First off, let me say I am happy to be a part of this organization. It really kind of touched my heart because it's something that's very, very dear to me. As you guys all know, I have a great passion for food. Not just how it's prepared or cooked, but also how food affects our body. And I started to change my concept in the way of how I eat things and how I would feel after I eat those things. So it started to be important to me to start eating healthier, making better choices when you dine out, not eating much processed food, but cooking at home. And also when I go to my local grocer, and like you were saying, some people don't really know how to cook seafood and they feel overwhelmed by it. How can they change it? Talk to your local grocer, and ask them different things that you can do. And also you would think salmon is very high. Instead of having a burger, have a salmon burger. Invite the kids in. I'm all about food, family, and fun. So it's so important to me that when you start to increase changes or have someone, because change can be, I know this for a fact, just me changing my body, and I started at 45, I'm 50 now, 2 daughters, 27 and 21. And when people look at me, they kind of go, I think I know her, but I'm not sure if I know her. But I think that's her voice, because my voice is pretty unique. So I can understand how I was received. I was actually ridiculed a lot. She had surgery, she didn't do this, she didn't do that, but I did the hard work. So I think this campaign itself is going to be a little difficult in getting people to sort of embrace it, because anytime you try to embrace change and change the mindset, change the heart, change what you're accustomed to, it's always difficult. So hopefully they can see me, visibly see me, hear what I'm saying. I'll be happy to offer up different ideas on how to prepare great dishes for them, and embrace that change and see that they can live a good, heart, healthy life. Encourage them to take the pledge and just kind of talk and be relatable and let you know that you can live a healthy life. You can exercise. We don't need to be taking all these drugs. Let's just do it the old-fashioned way. Get out, move around, and eat good and have fun. All right? So let's have a good heart talk. Thank you.
So much, Gina. Well, one of our most loyal and supportive spokesperson has been one of our founding board members, Detlef Schrempf. And you know him from being one of the first round draft picks for the NBA, 16-year veteran in the league, 3-time All-Star, an Olympian, and for the younger generation, you've seen him on Parks and Recreation. So we're so pleased that he's been so generous with his time to help lead this effort and be a great role model for health and wellness. And so love to invite Detlef up to say a few words.
Thank you, Linda. And for you that were there last night, here we go again, right? That's usually where I end up, right under a lamp. Honored to be here this morning. We had a pretty early start, I think 6 o'clock, which is 3 o'clock my time, and it's gone well this morning. I'm honored to be part of this, and I get this question all the time, even this morning from some of the media people is, what's a basketball player doing with this seafood thing, And I go, the Seafood Nutrition Partnership, you mean? Yes. I think it's a natural fit. When I was playing, obviously working out was a constant. It's something you did every day, but for me, part of my success was really living a healthy lifestyle and eating well, because I always thought that I had to have every advantage to stay where I was. So I always really worried about what I put into my system. Fortunately, I was in Seattle, so when we talk about the cities that Linda mentioned earlier, they don't see seafood every day. In Seattle, it's literally in every restaurant, in every store. You go into the grocery store, it's hitting you right at the door. When we go into these cities, Birmingham, Charleston, so on, literally people ask us, where do you get seafood? They don't even see it in the stores. They don't even know how to buy it. So we have huge challenges ahead of us. For me, I've been part of many programs over the years. The NBA has an NBA Get Fit program. It's fantastic. You go into middle schools and kind of do some fun things for them. Simple stuff. We're not trying to have them run 100 meters, but we want them to be active. Just like Gina said, just get up, get off the couch, give the Xbox a rest and be active. But it's a challenge because people we target typically have not moved in years, sometimes decades. It's never been part of their lives. And women 35 to 50, number one, risk of heart disease. But also they're the ones that usually feed the kids. They're the ones that make the decision about, do I take the drive-through and just get something because we're all tired, or do I actually run to the grocery store and pick something out and fix a nutritious meal for my kids? So it's really hard for someone that's never been active to tell them, hey, get your shoes out, we're going to walk 3 times a week, 5 miles. You gotta get healthy. But it's really easy to encourage them to say yes to something, and something they really don't know. So we have a yes campaign. We want them to say yes to seafood. Just say yes to eating seafood twice a week and see what happens. Yeah, there are challenges ahead. It's not going to happen overnight, and we think it might take a generation, because it's taken us 30 years to get what we are now, right? I remember 30 years ago we were pretty healthy. Now you walk around our cities and we're not. And So it's going to take some time. It's going to take a lot of education, but we want people to just feel good about it, to say yes to it and give it a try. And I think with that, take the Healthy Heart Pledge, and all of a sudden we have some momentum, and by the next generation, hopefully they'll live healthy. So thanks for having me, and I look forward to what we can do.
Thank you, Detlef. And last but not least, I'd like to invite one of our graduates from our Eating Heart Healthy program, Miss Jacquie Boston. Miss Jacquie was part of our first program that we ran over a year ago, and she really had a transformation through this program where 92% of the women experienced change. And so I'd love for her to come up and share her testimonial with all of you.
Now I'm getting the jitters. I'm from Roxbury, Tenants, Harvard. We would be considered an underserved community. A year ago, Linda brought this program to my neighborhood. I volunteer, and I usually go and do every program that there is. I got a phone call to do Eating Heart Healthy, and I'm like, healthy? Not gonna do it. Roxanne kept calling me, but I had been sick. I had been really sick. So I said, I'm not gonna do this program. It always gets me teared up because it really hit me. So I said I wasn't gonna do this program. I'm like, I don't wanna do it. I had surgery June 3rd. And the program started June 4th. So I left the Brigham and went to this program. I mean, I felt bad. But from the time I walked in through that door was such a transformation. I mean, we had a nurse practitioner, Eileen Soros, and Kelly, who was there. Linda was there. I mean, it just we felt so at home with this program that, we were rushing home to make these meals. We were, going out of our way, everyone bringing Kelly a sample. We called Kelly our rock star cook. Everyone loved her. I was in Boston Public Schools for over 15 years, and knowing the benefits, the things that I was taught in this program really surprised and shocked me and kind of scared me because I never knew that omega-3 was brain food in your 15-minute doctor's appointments. A lot of things they don't tell you. The things that we learned really, really shocked me. If I would have known that, I would have made sure every kid that I had in Boston Public Schools had some, ate fish twice a week. The kids in my neighborhood, I would have made sure they did it. But I'm really grateful. This year we're giving away book bags in my neighborhood, but we're gonna do it as a scavenger hunt. So one of the questions is, when you're at the bus stop, is stranger danger. But the second question is, if you eat seafood twice a week, along with all the recipes that we got from Chef Kelly, because they were really good. I mean, you leave a cooking class at 8 o'clock at night, and at 9 o'clock, you're posting pictures of, the fish tacos were the biggest hit. And they're posting pictures of fish tacos at 9 o'clock at night, and we're like, already? But yeah, wake the kids up and start them that day on the recipes. But, most of all, I would just like to say thank you. Thank you, Linda. Thank you, Kelly. And I will make sure that I continue to bring this to my neighbors, to my kids. And now that we have Dr. Waxman, we're gonna add a exercise component to it because we have a brand new $11.5 million gym. So we can make the food and then we can all go work out and we're all gonna work together. But thank you very much Linda, I am grateful, and I thank you. Thank you.
I'm gonna try not to cry. You know, all of you, many of you have worked in campaigns, and there are moments when you think about what component can we help to make this work better, and you know, what do we tweak to make sure that we're actually affecting behavior change. And you know, Jackie pointed to Executive Chef Kelly here from the Hyatt Regency Boston and our Brigham and Women's nurse partner. And we all came together, just like we are here today. We're coming together, marking this milestone, taking what we hear today back to wherever our homes are, families are, to make our difference in our own communities. And I can tell you that people are feeling a difference. Jackie called me third week into the program and said, I have not felt this sense of energy in so long. I feel so much happier and healthier. And I thought, how can 2 seafood meals a week help? She said, well, I eat fast food every day, 3 times a day. She loves fried foods.
There was no fried fish.
There was no fried fish in our recipes. But she said that made a difference in her. And now she's bringing seafood dishes to community programs in Roxbury, Tenants of Harvard. It's a residence of 2,000 residents. So with each class of 12 women that we help, it is affecting almost 800 people within their social media network, within their community, within their families. And all of you have that power. Just the other day in Oklahoma City, our teams have begun their effort, starting with an omega-3 screening at a local clinic. And one older lady came up to our team member and said, God must have sent me here today because he told me I had to increase my omega-3s and begin to eat some seafood. And she had said, I had no idea what I was supposed to do. I'm in Oklahoma City. So she said that she got screened and got some tips and samples of omega-3 capsules, and I was really happy to be able to do that. So you wonder about how we can make a difference, and with this food that people find special, they need help. Commercials and ads just won't reach people because it takes neighbors to help each other. And so I invite you to take our information back. I appreciate you being able to meet with each other and hope you'll stay connected. Make sure to go to seafoodnutrition.org and take the Healthy Heart Pledge. And I just want to recognize a few people here so that if you all want to talk with each other afterwards, please make sure to do so. We have our Scientific and Nutrition Advisory Council members here that is supporting us with our knowledge. And let me just go to, definitely you've met our board member Detlef Schrempf. We also have Dr. Tom Brunna from Cornell who serves on our board. And then for our donors, we have Hugh Welsh here from Royal DSM. He's president of DSM and one of our newest donors and partners. Hope you get a chance to meet him. We have great partners from NOAA, Women's Heart Alliance, Seafood Harvesters, American Cancer Society. Captain Keith Colburn is with us all the way from Alaska. And he's, Seattle. He's one of our great ambassadors. Representatives from Healthy Weight Commitment Foundation, National Fisheries Institute, National Aquarium, American Heart Association, Saving Seafood, our cardiologists from Memphis, Jacksonville, Birmingham, and Charleston, and also our ambassador, Michael Ann Rose here. And I just want to make sure that all of you get a chance to meet each other and really connect, because we're on this journey together. It doesn't change overnight, but we are seeing a difference because we are able to empower our neighbors to just try to eat healthy and see a difference in their lives and be heart healthy. So thank you so much for being here. I really appreciate you, and give yourself an applause. For those that would like, we'd love to have a group picture up front here with all of us, because this is a momentous moment. That's duplicate. So please come on up, and then I'd like to ask for our committee members that have joined us since yesterday to stay for a second photo. Thank you. Tall man in the back.